Hi, welcome back to Nurse Nita. Today I am gonna talking about the most high yield topic that's always be tested on the NCLEX exam. Today we're gonna talking about Lyme disease. Do you know why Lyme disease is always tested on the NCLEX exam? Why NCLEX exam loves to test you about this disease? Because Lyme disease is the most common disease and it's always cause a complication, a severe complication to the patient. And if you can see the news on TV, you can see that a lot of celebrities got this disease. Let's see who got the disease. You see, a lot of celebrities got the disease. And the recent news, if you might hear, you would hear that Justin Timberlake just got the disease as well. You see, it could be the most common disease. So that's why NCLEX loves to test you. Because the NCLEX want you as a nurse to know how to prevent this disease and how to help the patient to prevent the severe complication from this disease. Okay, we're gonna talking more about Lyme disease today, especially for you to pass the NCLEX exam. If you want to pass the NCLEX exam at your first attempt or at any time you take the test, you need to listen to this topic today. Today we're gonna talking about what is the Lyme disease, what is the key sign and symptom that the key points of the NCLEX exam, and the hallmarks of the Lyme disease that you need to remember because NCLEX always tests you about this, and some diagnosis, the treatment, and the nursing intervention. And the key point, one thing that you need to remember is the prevention. Lyme disease. What is a Lyme disease? Lyme disease is a tick-borne bacterial infection transmitted by a deer tick. If you can see, I show the picture of the deer tick here. This is you need to remember is the key point that the Lyme disease is a bacterial infection. If the patient got bit by the deer tick, it could have the Lyme disease. Now we go for the stages and key symptoms of each stages of Lyme disease. There are 3 stages of the Lyme disease: stage 1, stage 2, and stage 3. Stage 1 or early localized. It would take 3 to 30 days post-bite. The key symptom is bull's-eye rash. This is the key point, bull's-eye rash. It is the erythema migrans rash. You will see red circle. You can see the picture over here. I posted here. And the patient might have flu-like symptoms like fever, chills. Stage 2 is early disseminated. It's weeks or months. The patient might have joint pains, facial nerves palsy. This is the key point. Facial nerve palsy or Bell palsy, and might have meningitis and palpitations. Stage 3 is late disseminated. It takes months or years. The patient might have arthritis, especially on the knees, cephalopathy, and memory issue. The key points of the early detection of Lyme disease is bull-eye rash. So you can see in the early stage that the patient might have bull-eye rash. So if you see this rash, you need to notify the doctor immediately. Okay, we're gonna talking about the hallmarks of Lyme disease. I give you 4 B's. 4 B's for the hallmarks of Lyme disease that for you to easy to remember. B for bull-eye rash, B for Bell palsy, B for bone problem. It means the patient might have joint pain and arthritis. And B for brain problems and cephalopathy and meningitis. This is the key symptoms, the key hallmarks that you need to remember for Lyme disease. It's always tested you on the NCLEX exam. It would say that the patient come with the symptoms, these key symptoms, and what you should do as priority nursing intervention. Okay, so the diagnosis for the Lyme disease include clinical presentation, exposure risk, and the ELISA test. This is a key point. ELISA test and confirmed by Western blot. This is the key point for the diagnosis. You need to remember this as well. And for the treatment, NCLEX exam always tests you about the first line drug that we use to treat the Lyme disease. So you need to remember this name of the medication of antibiotic. The first line drug that we use to treat the Lyme disease is Doxycycline. Is a first line drug or first line antibiotic that we use. So an alternative antibiotics, it includes amoxicillin or cefuroxime and ceftriaxone. Okay, key point, the first line drug is Doxycycline. The NCLEX might ask you about the treatment, the key priority of treatment, the first line drug of treatment that we use in Lyme disease, and NCLEX may give you 4 names of antibiotics, and you need to choose the first line drug, which is Doxycycline. Okay, now we're gonna go for the key priorities on the NCLEX exam. Nursing intervention. I'll give you the priority nursing intervention that you need to do when you got the patient with Lyme disease. First, educate on tick prevention. So you need to give the education to the patient on tick prevention, including key point, including wear long sleeves, use tick repellents, and check body for ticks after being outdoors. Remove tick with tweezer gently. Okay, bite grass close to the skin and pull straight out gently. And another key nursing intervention is administer antibiotics as prescribed, especially the first line drug like Doxycycline. Okay, and you need to monitor for signs and symptoms of the complication, the severe complication like Bell palsy, meningitis, and encephalopathy, and the joint pain. Okay, this is all about Lyme disease that you need to know for the NCLEX exam. If you want to pass your NCLEX exam at your first attempt or any time that you take the test, you need to remember all these key points, make yourself understanding about all these key points, and apply for your test exam. Now we go for the example question on the NCLEX exam about Lyme disease. I'll give you 4 questions today. You pick your choice and you see the answer in the comment below. Okay, we go for the first question. Question number 1. A client present with a bullseye rash and flu-like symptom 5 days after hiking in the woods. Which intervention is appropriate? A. Reassure the client that no treatment is necessary. B. Administer oral doxycycline. C. Apply topical antifungal cream. D. Monitor for development of joint pain before starting treatment. You pick your choice and see the answer in the comment below. Okay, we go for the question number 2. A nurse is teaching a group of campers about Lyme disease prevention. Which statement indicates understanding? A. I will use insect repellent that contains DEET. B. Ticks need to stay attached for only a few minutes to transmit disease. C. I should squeeze the tick body to remove it. D. If I don't see a rash, I don't need to worry about Lyme disease. Okay, question number 3. A client with Lyme disease had facial droop and headache. What complications should the nurse suspect? A. Meningitis. B. Stroke. C. Bell palsy. D. Guillain-Barré syndrome. Okay, the last question, question number 4. Which instruction should the nurse give when educating a client on tick removal? A. Burn the tick with a match. B. Apply petroleum jelly to suffocate the tick. C. Use tweezers and pull stretch out gently. D. Twist the tick counterclockwise for easy removal. Okay, you pick all of the answer and see the answer choice on the comment below, okay? Okay, I hope that this video could help you for NCLEX exam on Lyme disease topic, and I wish you pass the NCLEX exam on your first attempt or anytime that you take it. Thank you very much today. See you again next time. Bye.